Osteopathic sports medicine physician and co-owner of Alliance Regen and Rehab, where we specialize in non-surgical orthopedics and returns to sports medicine. We are your one-stop shop for joint repair. Where is that?
I get it.
So just really quick about me. I'm a lifelong learner and giver. Co-owner of Alliance Regen and Rehab. I'm also faculty at Gulf Coast Ultrasound Institute, where I teach other physicians on regenerative therapy and diagnostic ultrasound. I'm also a board member of Pinellas County Osteopathic Medical Society, and I just recently got invited to be on faculty at the International Association for Regenerative Therapy, where I will present and teach a skills lab this coming fall at their annual conference. Board certified in family medicine, osteopathic manipulative medicine, as well as sports medicine, where I was fellowship trained. Done multiple medical mission trips that I love to do. I got my Bachelor of Science in Kinesiology at LSU, and then followed up at Nova Southeastern, where I got my medical degree in 2010. So quick story about pain and how it progresses. You got pain, and then once this pain sets in, left untreated, you develop dysfunctional movement patterns. You get avoidance or disuse of that issue because of the pain. You become sedentary, fatigue, depression sets in. You have decreased productivity, whether it's at work or home. Suffering, your relationships start to suffer because pain changes a person. So what can we do about this? A lot of patients that go through this typical journey about pain. These are really hard to see. I'll tell you about them. They're doing all these things certainly around their pain. Maybe they see their primary care physician because they have a trust with them, they value their input. They're not going to train to take care of their pain. Or they see ortho because they have status attached to them. They're gods of the musculoskeletal system. You may get a vague diagnosis, maybe get some pills, some creams. Maybe you get a cortisone injection, which is harmful in most cases, or a surgery that's just unneeded in most cases. Maybe they try some physical therapy, that's good, that helps. X-ray, MRI, maybe they're trying braces or straps and just trying to get this stuff. Maybe some massage therapy, some stretching, some cupping, some dry needling. Now, all these things are not necessarily bad. We use a lot of these things, but without an actual diagnosis, you're just chasing pain and symptoms. So what this causes a lot of wasteful time and money expenditure. So these bills start to roll in, and you still don't know exactly what you're treating, just pain. So what can we do to zero in on this pain? Like a bullseye with some precision and accuracy. I'll give you the Alliance prescription. We take this patient through our Alliance journey. Now this is with most doctors, they should be doing a history exam, assessment, and plan. The way we differ is where most doctors, average office visit lasts about 7 minutes. It takes me at least that time to get to the history. I want to know what's your pain point, what have you gone through, what are your frustrations. Then I'm going to do a detailed exam where I'm going to do a diagnostic ultrasound, look at the tissue, see what we're dealing with, stratify this tissue. Is it just inflamed? Is it tendinotic? Is it torn? It all looks the same in most cases on exam until you actually look at it. If I need to, I'll do a diagnostic injection with lidocaine, numb the area, retest the patient. Once the exam becomes normal, we know what we're dealing with, how to fix it. From this, we've developed our assessment. We're not just confined to a list of diagnoses that the insurance companies give us. We're actually putting a name to what this problem is. And then we do a lot of education on anatomy. Then we develop a personalized plan that is tissue and goal specific to the patient and financially tailored. Not everyone can do every treatment, but we have something for everyone. All right, so before we go any further, I want to shed some light on something. CMS stands for the Center for Medicare and Medicaid Services. They determine what diagnosis and treatment is going to be covered by insurances and how much. They also have these codes that have to match these procedures. They have to match up identical for the payment to go through. Now, residency positions or residency programs, they teach doctors on how to be a doctor. And how do these hospitals get their funding? CMS. So these clowns that are set up the process are teaching the people to go through. It's a whole indoctrination. So there's a common misconception among doctors and patients that if my insurance doesn't cover it, it must not be safe or effective. Or if my insurance does cover it, it must be safe and effective. Totally false. The freedom to think freely and question the system is strongly discouraged. And the system is designed to keep you dependent on it. So look at the pharmaceutical industry. You've got advertisements for your commercials, you don't even know what the hell they're treating. So, I want you to be aware that there's a lot of masqueraders out there in the area pretending to provide miracles. I want you to beware of stem cell clinics. All right, so what do we do at Alliance? Using functional sports medicine, we provide hope, options, we walk alongside of you, improve your quality of life. We do this, like I said, with musculoskeletal diagnostic ultrasounds, so we can see the tissue. At times we'll do diagnostic injections, like I mentioned. We'll do nerve blocks, type of dissection, to free up the nerves. We have something called orthobiologics that we use to strengthen and repair tissue. Once we make the tissue stronger, the pain goes away. Some of these things are dextrose gold therapy, platelet-rich plasma, full of growth factors, and stem cells. Autologous stem cells, meaning from the patient. We're not buying stem cells from a bank that could be dead or infected. We're getting them from the patient. Thank you. Also, bioidentical hormone replacement, physical therapy, performance development, and in a nutshell, find the pain quickly and fix it. There's a couple of videos here of me using the ultrasound to get the needle right where it needs to go. This improves our accuracy, improves our safety, and improves our outcomes. The far right is kind of fascial tear. This patient came from another doctor's office to a different treatment, but they didn't know what they were treating, so the treatment didn't work. Well, all right. Keep that.
Yeah, which one?
No. There.
How do I play it? This one?
There.
There it is. I'm trying it. It's tough. It's tough. Technical difficulties. Michael, please come help.
This is one of my patients who became a good friend of mine. This is, if any one of you know baseball, this is Jason Worth. He played at the Phillies, had a 15-year career, Phillies, Nats. And he lives in Florida, and I got him to send me a testimonial, and we're not able to, which is a really good testimonial. Talking about his experience with me, his experience in the pros and surgery and outcomes, and how that's not always the best option, and that should be your last option.
Hey, how's it going? Jason Worth here. Been retired from a Major League Baseball career for about 4 or 5 years now. Met Dr. Broussard once I moved to Florida 4 or 5 years ago. He met him through some of my old therapists and doctors. Got to know him now pretty good for a while, and I've been sending a lot of clients and patients to him. In professional sports, you deal with a lot of injuries, chronic and acute, and you learn how to combat injuries and get through them. You got to play while you're injured, and you learn how to deal with stuff a little bit differently than most people. Typically, traditionally people, they call the doctor, they go to an orthopedic surgeon, which can be useful, but is typically probably the last place you want to end up or use the hardest place. And I send people to Dr. Broussard as kind of a first stop, a first line of defense, if you will, from the DO side or the sports medicine side. You kind of get the best of both worlds with Dr. Broussard. You don't want to rush into surgery necessarily, and a lot of injuries and chronic use situations can be dealt with pretty easily, given you're in the right hands. So not 100% sure of my audience here today, but I can tell you, anytime I have an issue, I call Dr. Broussard. Anytime I run across friends or family that have issues, I call Dr. Broussard. I think it's an intelligent way of looking at injuries and just overall health. So whether you're a kid, an active kid that's playing sports in high school, or you're the weekend warrior golf.
All right, Mr. Metis, you can dive that, and I thank you for your time. Appreciate it. Don't operate, regenerate.
Oh, nice.
This was from my honeymoon in Jamaica. If you want to send someone to us, have them give us a call. The number's on the sheet or email. Please don't do a three-way text. I know it's helpful. It's easier for you and your client or your referral, but I don't want my patients to have that access to me having my cell phone number. So I appreciate your time and all your referrals. Thank you.